Tell me about the study and how it was conducted.
The study that we published in the journal Science a couple of months ago now was basically trying to look at the impacts of DACA on the mental health of the children. So the motivation for this was that right now the United States is basically embroiled in this heated debate over what to do about the undocumented population, right? There's about 11 million undocumented people in the United States right now, and there's big debates about what should be done about them, right? Should they be given sort of some path to citizenship? Should they be deported? And there's a lot of policy debate about what kind of policies should be implemented. And one of the most significant policies that was implemented towards the undocumented population was the so-called DACA program, the Deferred Action for Childhood Arrivals program, which in 2012 under the Obama administration was announced and basically gave a particular subset of the undocumented population, this so-called Dreamer generation. It basically gave them temporary protection from deportation and the right to work and a social security number. And so there was a big question about what impacts did DACA actually have on the people that received this temporary protection. But a lot of this debate focused on the Dreamers sort of themselves. And one thing that we were particularly interested in was, well, a lot of these like Dreamers who came into the United States as children, they are now young adults and they have children of their own. And so we were interested in what's the effect of basically DACA for the parents on the children of these undocumented immigrants. And so are there any intergenerational effects? If there are benefits from DACA, do they get transmitted to the kids? And that's very important because these kids are not only typically US citizens, but they're also sort of the future. And there's a lot of kids that are in that category. So in the United States overall, there's about 4.5 million children who have at least one undocumented parent. And at the time when the DACA policy was announced, there were about 200,000 children of DACA eligible individuals. So it's an important large group, and we were interested in what happens to those children if their parents get DACA protection. That was the motivation for the study.
How did you decide to focus on the Medicaid claims in Oregon for this study?
If you want to study the impact of a policy like DACA, then you're basically up against two problems. The first one is that we don't know much about the undocumented population because in general, right, they don't answer government surveys, they try to stay under the radar, and so it's not easy to find a large systematic sample of undocumented individuals that you could then go on and study and measure their health, say. And so we were able to solve this data problem by looking at one specific government program, which is called Emergency Medicaid, which covers labor and delivery regardless of documentation status, and it's overwhelmingly used by undocumented women to basically deliver their children in hospitals. And so we were able to get data from the Oregon Health Authority, which allowed us to look at births that were covered under emergency Medicaid, and because they're covered under emergency Medicaid, it's very likely that the mother was undocumented. And then because the children are born in Oregon, they're US citizens, and they're typically eligible for full scope Medicaid, and we were able to track the health of the children through these Medicaid claims. So it was basically a breakthrough because it gave us like the first sort of large systematic sample of undocumented immigrant mothers and then linked to their kids so we could look at what happens to their health. The second big problem that you're up against is that you need to kind of isolate the effect of DACA, right, from other differences in characteristics that DACA recipients differentiate from non-DACA recipients. So if you just look at DACA recipients and you find they're better off than non-DACA recipients, you don't know, is it DACA? Or is it just the fact that the people who get DACA, they tend to be younger, better informed, and so there could be a lot of other differences that could be explain why they might be better off. It's like a selection bias because the DACA, right, the program, it's not for all undocumented immigrants, only for a subset of them, these Dreamers who tend to be younger and better off. They're often educated in the U.S. And so in order to overcome this problem, right, how can we distinguish correlation and causation? We looked at a particular subset of mothers that were born just before and after a DACA birth date eligibility cut point. So basically the policy said you needed to be born after June 15th, 1981 in order to be able to get DACA. And so we could compare mothers who were born just after and just before, and because they are born just a few days apart, right, essentially some of them got lucky, were born like 1 day later, they were able to get DACA. The other mothers got unlucky, they were born 1 day too early, and so they couldn't benefit from the DACA protection. And so that's a little bit like a situation where DACA is as good as randomly assigned, just like you could assign it in an experiment, but there it just happens, a total arbitrary cut point. And so that gave us that separation into mothers that got DACA and mothers that didn't get DACA that were otherwise very similar on all other sort of background characteristics.
What did the study find?
So the study basically finds that if you compare the children of these mothers that were born before and after this cut point in the pre-DACA period, the rate of mental health diagnosis of these children is exactly the same. That's what you would expect, given that these mothers are just, the only difference is their birthdays are 2 days apart. But then if you look in the post-DACA period, right, you compare the children of these mothers. The mothers who were born after the cut point, they get DACA. And it turns out that the mental health diagnosis of their children in the post-DACA period drops by about 50%, indicating that DACA protection for the mothers significantly improved the mental health of their US-born children. And it was quite a sizable effect, about a 50% drop. And we found that in the main outcome that we were interested in, which was so-called adjustment and anxiety disorders, which are an important form of mental health disorders, which are the ones that are diagnosed and attributed to an external stressor, as opposed to, there's a lot of mental health disorders that are driven by other physiological factors, biological factors, but these are the ones that are driven by social external stressors. And so this could be the parents getting deported, or the parents getting arrested, or it could be the parent situation improves. Maybe because of DACA they are able to find a job that could improve the family situation, relieve stress, and therefore the children experience less stress and are less likely to suffer from these mental health problems.
Were you expecting to find such a big drop, the 50% drop?
Yeah, there's two things I think that are very interesting about, or surprising, what was surprising to us about the results. One was that this drop was very, very large. So as I said, about a 50% drop, indicating, that tells you that there's just a lot of stress that these children face, that these families face, because they're always fearing that, that their parents might be deported. And so the magnitude of the effect was definitely surprising. The other thing that was surprising was that you get this effect pretty much instantaneously. So at the moment that DACA basically gets put into place, the mothers get the DACA protection, you see an immediate reduction in these mental health diagnoses. So it's the onset of the effect was very quick, and it was a quite large magnitude.
Is this the first time there's actual proof of these findings?
Yeah, I think it's the first study where we can really confidently isolate the effect of the DACA protection, the DACA eligibility of the mothers on the mental health of the children. There had been other studies that tried to quantify the effect of DACA on the recipients themselves, but they typically have a hard time isolating this effect of DACA from other differences between DACA recipients and non-recipients. But because we could compare these mothers that were just born like a few days apart, it's really hard to argue that there's any other reason why in the post-DACA period suddenly the children of mothers that are born on June 16th is dropping, while the mental health of the kids of the mothers that are born on June 14th who are not eligible for DACA, while that remains at these higher levels that we had before. It's really hard to argue. There's nothing specific about having a birthday on June 15th that could explain this drop in the mental health diagnosis of their children. We only see that because of DACA.
Based on these findings, what do you think needs to be looked at next?
Well, I think the findings have some obvious implications for the ongoing debates about now what to do about sort of the DACA program, right? The current administration has rescinded the program, and currently it's sitting in Congress where politicians have to make a decision about, should we continue the program? Should we offer a permanent path to citizenship to these dreamers? And so I think what the results pretty clearly show is that a policy like DACA does not only have effect on the recipients themselves, but has these broader multiplier effects. They basically get transmitted through families. So here we see that this next generation of US citizen children benefits tremendously from the DACA protection of the mothers, and that has important implications in terms of setting up these kids for success rather than potential failure. We know that early mental childhood disorders are highly correlated, typically with problems later in life. So there's a strong correlation between early mental childhood disorders and higher risks of depression, lower earnings in the labor market, lower educational outcomes, and so you have this cascading effect of early problems. And so if you can reduce these early problems, essentially through an act of Congress, like that's one of the few instances where you have, a social determinant of mental health that you can actually change through policy. And I do think there's implications of costs for that, right? Because we already know that sort of the treatment of mental health, early mental childhood disorders already accounts for the largest share of pediatric healthcare spending in the United States. You could save, in that sense, DACA protection saves a lot of money by helping to improve the mental health of these children. So you need to take a broader view. You need to take these costs, these multiplier effects into account. And more broadly, I think it just shows that really the undocumented status of the parents is sort of a significant contributor to that basically hampers the normal development of these children and really contributes to sort of the intergenerational transmission of disadvantage that can happen in these families.
Are you going to take this study and look at other states?
Yeah, we are now trying to replicate this in other states. So we are in negotiation with the state of California to get their Medicaid data so we could look in California, where this is obviously also a big issue given that there's a lot of undocumented immigrants in California, and we are trying to replicate it in other states as well. So I think it's something that we are actively working on. And there's a variety of other questions, I think, that we want to look at. So for example, now as the lives of these, the future of these, of the dreamers and their children is very, very much hanging in the balance. We want to know, how does a statement like, rescinding the policy, how does that affect their mental health? Are these gains that we've seen with DACA protection, are they now being reversed? That's something that we would expect given this data, and something that I think needs to be quantified if you want to make a decision about a policy like this really based on some objective facts about what happens, what are the costs and what are the benefits. So that's something that we're trying to do actively.
Who funded the research?
This research was basically done by the Immigration Policy Lab here at Stanford in an interdisciplinary team of researchers, where also there were researchers from the Oregon Health and Science University were contributing, and there was a legal scholar at Kellogg that also participated in the study. So it was a large team of people, but the core was pediatricians from the Stanford Medical School and us here at the political science department, basically getting the data and running the analysis. We had funding from the Russell Sage Foundation for this project, and we had the Stanford Immigration Policy Lab get supported by the Ford Foundation for our operational support. So they pay for our infrastructure. And so these were the two main funders.
You mentioned the study was published in the Journal of Science.
The study was actually published right on the day when the announcement was made to rescind the policy by the Trump administration. So at the time, the timing was in that sense really spot on. And so it created a lot of attention at the time when the study was published. A lot of people took it up on social media, and it was covered by quite a few newspapers. And so the timing of it was quite fortunate. We definitely hope that this evidence gets in the hands of decision makers. And so we had, for example, the Attorney General of California. They currently have a lawsuit against the Trump administration over the rescinding of DACA. And so they, for example, submitted this paper into evidence as a statement of fact for their ongoing litigation, because it's really very clear demonstration of the harm that can happen as a result of rescinding this policy. So I think this evidence can contribute to these ongoing debates, but we hope that the results can be more broadly shared and that people can make decisions based on this evidence.
What would you like other policymakers, specifically in Washington, D.C., to know about your work and what you and your colleagues are doing?
I think everybody should be concerned about the mental health of children, because children are the future, and we know that these early mental childhood disorders can be so detrimental to the future of these kids. So there's huge societal costs that come from these early problems. And so I think if you're worried about the mental health of children, then you need to look at the DACA policy also through this lens, and not only through the lens of what happens to the people who immediately get protection. The fact is that there are a lot of U.S. citizen children now who have undocumented parents, and quite a few of them benefit from this policy. So to the extent that you want to represent the interests of these children, I think you need to take that into account when you're making a decision on DACA. So, in this case, it's very clear that I think the gains that we've seen in terms of the improved mental health of these children would be reversed if the policy were really rescinded and these dreamers wouldn't be given some form of more permanent protection. And so my hope would be that this is something that will be taken into account as these decisions are currently being made.
Tell me a little bit about the Immigration Policy Lab.
The Immigration Policy Lab here at Stanford is an interdisciplinary initiative where we do a lot of sort of very applied policy relevant research that is trying to quantify, using sort of rigorous statistical methods and experiments, the impacts of policies that affect immigrants and refugees in the United States, but also in other countries like is in Europe or in the Middle East. And so what we do is that we typically partner with policymakers or with immigrant service providers who are on the front lines trying to address issues that immigrants face and the communities in which they settle, to try to think about what are the most important questions that need to be answered, what are the most important policies whose impacts need to be quantified. And then we try to work with them together to collect data and get studies off the ground to really try to quantify the impact of these policies. And the goal is that these studies can lead to better decisions, because now you have evidence on the returns to these policies. And another big part of what we do is also try to come up with innovative ways of improving some of these policies. So through these partnerships, what we often learn is policymakers not only want to know the impact of the policies that they're implementing, but they also want to know how can we do better, right? What would be a better way to design a specific policy? And so we're working with them to try to innovate in these areas, to try to come up with better ways of addressing the issues that immigrants face in the communities in which they live.
We're talking about the mental illness side effects that children can get as a result of knowing their mothers are not protected under DACA. What are the type of illnesses that could result in that?
In the research on this, what people often tend to find is that there is a cascading effect of early mental childhood disorders. So if early on there are problems with mental health, that can translate into a higher risk of mental health problems later in life, in particular a much increased risk of depression. But it's also correlated with other problems like lower performance in school, which ultimately translates into lower earnings in the labor market. And so there's a whole variety of sort of social health outcomes that are affected by these early mental childhood problems.
Do you have any thoughts or advice of how schools should handle this if they see children there that are under stress because of the situation?
I'm not an educator in a particular school setting where I interact with a lot of children, but it's certainly something. I mean, people talk about toxic stress that a lot of these children can face in these extreme situations. And imagine your family being sort of torn apart, or you come home and it turns out your father has been arrested and is now face deportation. So I mean, it's definitely something that I would hope that the school system can help support these children and get them the right care that they need in terms of referring them to mental health professionals that can help them tackle some of these issues. But obviously, if you can avoid these problems in the first place by setting up the parents for success, as we see through the DACA policy, that is a much better way in a sense of dealing with this issue. And I do think it's very clear that I mean, a lot of these children, I mean, imagine even their parents themselves, they have been brought into the United States as children. A lot of them don't know any other country than the United States. They often don't even, they have very limited connections to their home country. So if they're now being asked to be deported home to their country, it's very unclear how that would even be sort of possible, or what would happen to them, and then let alone their children, which either they have to leave them behind in the United States under some legal guardians or something, or they take them with them, and then the children are they're born, they're U.S. citizens, and so it's a very problematic situation, I think, for all of us. That just shows that at that point, right, we have about 800,000 people who have received DACA protection over the last couple of years. So that's a large group of people, including all their children, which are very, very negatively affected by this. And in a way, I mean, at this point, a lot of them have gone through the U.S. educational system, right? They're young, they're contributing, they work in jobs, here in the Silicon Valley. I mean, most of the companies came out and they said, we have DACA folks working here and they're making a contribution. So sending them home at this point would really, I think, mean that you're not getting the benefits, the contributions that all these dreamers are making to the U.S. economy and U.S. society.
Tell me a little bit about this graph that I see behind you.
What you see in this graph is we basically have on the vertical axis the percent of children that are diagnosed with mental health problems, and that's plotted against the horizontal axis, which is the birth date of the mothers. The line is the average diagnosis rate, and the dots are average diagnosis rates within 15-day intervals of the mother's birthday. And the key is really to focus your attention on the middle of the chart, where there is this vertical dotted line, the dashed line. That is the birthday cutoff for DACA. So women that are born before that cut point are not eligible for DACA. Women that are born after that cut point, they are eligible for DACA. And what we see is that right there at that cut point, when you compare mothers that are born just the day before or just the day after, the children of the mothers that are born after that are eligible for DACA protection, their mental health diagnoses are much lower than the mental health diagnosis rate among the children of the mothers that did not get DACA protection. And because we're making this comparison like very right there, where there's no other difference between those mothers that would explain why the mental health of their children will be that much better, it's pretty clear evidence that that must be coming from the DACA protection for the mothers.
How is the mental health of these children measured?
There's a standardized coding system for mental health diagnosis, and this is looking at all the children that were diagnosed with a specific set of code that is for adjustment and anxiety disorders, and these are clinical diagnoses that are typically made either by pediatricians or mental health professionals in the hospital or mental health clinics where the children are referred to in Oregon.
Tell me about your educational background.
I started out studying in Germany. That's where I'm originally from. I studied at the University of Tübingen, studying political science, economics, and public law. And then from there on, I got a scholarship to study at Brown University in the United States. And I went there, and then from there I went to the London School of Economics and got a degree there in political science and political economy, more specifically. And then from there I got a scholarship to go to Harvard, where I did my PhD in government and also took a lot of training in statistics. And that's where I completed my PhD in 2009.